My name is Diamond Woodson. I am a nursing student at Indiana State University, and today I will be presenting sexual abuse prevention in children. According to the CDC, childhood sexual abuse has been identified as an adverse childhood experience. Why is this significant? Kaiser Permanente Adverse Childhood Experience is one of the largest examinations of childhood abuse, neglect, and household challenges, and later life health and wellness. This study has linked adverse childhood experiences to health risk behaviors and disease in adults. Therefore, childhood sexual abuse is identified as a substantial yet preventable public health problem. At the end of this presentation, participants will be able to define childhood sexual abuse, identify risk factors of childhood sexual abuse, assess and identify warning signs of childhood abuse in children, classify impact and consequence of childhood sexual abuse, list and perform prevention measures for childhood sexual abuse, and lastly, recognize the possible outcomes of the preventative approaches. You may want to pause this video to take the pretest so that you can evaluate how much you have learned at the end of this presentation. What is child sexual abuse? Child sexual abuse is sexual activity with a child under the age of 18. Sexual activity with a child violates the law and social norms of society. The child does not fully comprehend what is happening to him or her. The child does not agree to or is unable to give conformed consent to sexual activity. Lastly, the child is not developmentally capable or cannot give consent to sexual activity. Risk factors have subdivisions, which include individual, family, and community. Individual risk factors may include a lack of parenting skills or understanding of the child's developmental process or needs, a family history of substance abuse or neglect, a family history of mental illness like substance abuse and depression. Risk factors can include parental characteristics like young age, low education, single parenthood, a large number of dependent children, and low income. Non-biological caretakers in the home can be a risk factor. Maybe the mother has a male partner. Lastly, the parent may have thoughts and emotions that support or justify maltreatment behaviors. Family risk factors include social isolation, family stress, separation or divorce, and violence, including intimate partner violence. Lastly, other family risk factors include parenting stress, poor relationships between parent and child, and lastly, negative interactions. A community risk factor is concentrated neighborhood disadvantages like high poverty, high unemployment rates, high density of alcohol outlets, and poor social connections. Warning signs of sexual abuse in children include physical signs, behavioral signs, and emotional signs. It is important to note sudden changes in behavior. If something seems off, do not ignore it. And if a child tells you they are uncomfortable around someone, listen, even if they are not specific. Take this time to pause the video and read through the warning signs of sexual abuse in children. As discussed previously, sexual abuse in children is an adverse child experience, which affects how the person thinks, acts, and feels throughout their lifetime. The consequences can be physical, mental, and emotional. Physical consequence could be unwanted pregnancy, physical injury, and chronic conditions later on in life, like obesity, cancer, and heart disease. Mental consequences include PTSD, which stands for post-traumatic stress disorder, and depression. Behavior consequences include substance abuse, including opioid use, risky sexual behavior as in multiple partners and unprotected sex, and an increase in risk for suicide or suicide attempts. How do we prevent sexual abuse in children? Change social norms to support parents and positive parenting. Approaches include public engagement and educational campaigns, and legislative approaches to reduce corporal punishment. There is evidence suggesting these approaches can impact behavior related to child abuse and neglect. Potential outcomes include shifting perspective, responsibility for children from personal to shared responsibility. 2, including a public support policy supportive of children and families. 3, reduce and belief that corporal punishment of children is appropriate. 4, reduce and report use of corporal punishment. 5, increase in the belief that nurturing children at every age is appropriate. 6, reduction in belief that getting help for parenting is bad. 6, increasing seeking help for parenting. Lastly, increasing public awareness of factors that can inhibit or promote healthy children development. The second prevention is strengthening economic support for families. Approaches include child support payments, tax credit, state options for managing federal nutrients assistance program, assistant housing mobility, subsidized child care, friendly work policies like livable wages, paid leave, and flexible and consistent schedules. Several approaches providing economic support to families have demonstrated direct effect on child abuse and neglect. Expected outcomes include reduction in physical abuse of children, reduction in neglect, reduction in maternal depression and parental stress, reduction in adolescent risky health behaviors. Another method of prevention is providing quality care and education early in life. The approaches include preschool enrichment with family engagement and improved quality of child care through licensing and accreditation. These approaches can prevent child abuse and neglect and may possibly provide other upstream benefits to children and families, which will be discussed in the document I have provided below. Potential outcomes include reduced encounters with child welfare services, reduced physical and sexual violence against children, and lower rates of out-of-home placement. The last prevention I am going to discuss is enhancing parent skills to promote healthy child development. Approaches include early childhood home visitation and parent skill and family relationship approaches. The effectiveness of these approaches vary by model and program. Possible outcomes include reduction in childhood abuse and neglect proliferation, reduction in risk factors for child abuse and neglect, improvement in parent and child interaction, improvement in parenting behaviors, improvement in violent prevention, related knowledge, behaviors, and beliefs, fewer emergency room visits and hospital stays, reduction in the use of welfare, reduction in criminal behavior, and reduction in youth substance use and arrests. That concludes my presentation. Go take your post-test and do not forget to check out the links I provided below.